Welcome back to Lee's Lessons. Today I'm going to talk about why the saying, no pain, no gain with exercise can be harmful, especially if you have POTS. So as a physical therapist, I give one piece of simple advice. If exercise is causing pain, stop. Exercise should not cause pain. Pain is a great warning sign from our bodies that something is wrong and we're going to get an injury if we continue into that pain. And with the POTS population, it's really important that we have to listen to our bodies. And this is because many of us have other comorbidities, such as hypermobile Ehlers-Danlos syndrome, which can increase that risk of long-term injuries. An exercise program for POTS should be started in a slow and low intensity. And I'm actually okay if you say, ooh, this is easy. Easy's good. That's a great starting point. And as you progress with your strengthening and your cardiovascular activity, you're going to find it more challenging. You're going to find over time you're going to have a cardiovascular fatigue. You might even have some mild to moderate muscle soreness the day or two after you exercise. And that soreness should be improving around that third day. What you should not feel is pain in the tendons or your joints after you exercise. If you do, you really need to reevaluate. What is the activity that you're doing that's causing the pain? Maybe you need to change the intensity of the activity or even the time duration of the activity. Sometimes this can be a really simple fix, such as maybe a brace needs to be worn if you tend to be hypermobile in your knee and you hyperextend. Maybe a brace in the initial part of strengthening, and then you can slowly wean off of that brace. If you're doing an exercise such as like a leg press and you tend to hyperextend, you could use a towel roll to help block that hyperextension. I also really recommend to watch the joint. So when you're doing an exercise, look to see what your joint is doing, because proprioceptively you may not know, and visually you can then see, wait, my joint's going beyond the range that I want it to and I need to limit that range. So when you start a cardiovascular activity, you want it to be with a light resistance and maybe even no resistance. And this is important. We have to think about that low intensity and then that duration. It doesn't have to be high. It could start at 30 seconds, especially if you're not exercise tolerant. So for most people with POTS, we might feel our symptoms get worse in that first 4 to 6 weeks if we haven't exercised and we're initiating a program. There will be improvements if we keep it slow and low, right? We keep that intensity down and we slowly progress and we're just really consistent with what we're doing. My big advice when we're starting an exercise program is to be patient with yourself. Go slow, listen to the body, avoid pushing into pain, and allow that rest breaks as your body needs when you're exercising. Okay, have a great day and I'll see you next week. Bye.